your parts. And you can see how easy it is. You push the button and get started. How's your pain level, Jessica?
Great.
It's really not a painful procedure. I like to overlap about 30% because you can see that the inside of this is it's not all on the handpiece, so you want to overlap to be sure that each of those little grids is going to get all over on her skin. So, and you can see it's harder to do where it's not so fleshy. And sometimes I'll need to come along with the tiny handpiece too. But you can see how fast it is. So what we do at Disappearing Act is we do a timed procedure. So for somebody who wants to pay for 20 minutes of a treatment, they can get their lower legs done now in 20 minutes. So the cost would be $250 for a 20-minute treatment. And that's the most popular package because somebody could get their bikini line done and their underarms done and hair on their face or their toes in 20 minutes. It's a little tougher to get legs done with all the other areas in 20 minutes. And usually people who want their whole body done will schedule an hour, or sometimes they'll schedule 45 minutes. But when you do a package, you get $250 off. So that is our most popular. So for $1,000, somebody could get permanent hair reduction and never have to shave again in the areas they get treated. And you can see it's slightly pink where we've done it, and that's a really good response. And knees used to be hard to do, but now with this handpiece, it's incredibly easy. Just sucks the knee in. So the vacuum assist in here brings the skin right up to where it needs to be, and it's really very nice. So Jessica, this is your graduation. You're never going to have to shave again. How does that feel?
Oh, it's going to be awesome. Can't wait.
And with Jessica, we have gotten to do her entire body, so when she becomes a mom someday, she's never going to have to let that baby sit and wait for her, because she's just going to get in the shower and out of the shower. And let me tell you, as a new mom, that was the worst part, is the 20-minute showers when the baby's crying.
Oh, all the shaving.
Yeah, and they're just sitting there waiting for you crying, and so this will be a really good pre baby shower gift to you. To yourself. You're smart. Okay, so now we're going to treat Jessica's armpits, and this is a much more sensitive area for a lot of people, especially people who are ticklish. They tend to have more sensation around their armpit area. And you can see there's hardly any hair left anymore. It used to be very, very thick. It used to look shadowy, and now there's hardly anything left. But it still is going to be more painful for Jessica. But it's very quick. I'll show you how quick it is. I usually start at the bottom and just inch my way up again with a lot of overlap. Sorry, Jessica, I know it's more sensitive, but it's very quick. And then I get to the very top, the apex of the area, and then I go this way just to be sure I get it all. And I get it twice in the armpit because I really want to see, I want to see most of that hair gone forever. Okay, that's all there is to it. It's more sensitive, isn't it?
Hurts a little bit more, but it's okay.
Yeah.
It's better
Right.
this time.
Yeah. Oh, good. Well, the more, when you get to the end of your sixth treatment, everything hurts less.
Yeah.
Because there's less gas to
it definitely
heat up.
does hurt less.
Yeah. Thank you, Jessica. Great patient. Final area on Jessica today is going to be her upper lip. And there's not as much hair as there used to be 5 treatments ago, but it's still a very sensitive area as well. And we have to use the tiny handpiece with that little tiny square now because you can't use the big handpiece on such a small area. So because it's the most sensitive spot on our face, I have my patients put their tongue where I'm going to be, right underneath the chill, and then I wait a few seconds and let it get really cold, and then I fire. So really a few seconds, her tongue's right under there, and push. And this just helps it hurt a lot less, and it also gives it some tension. So wherever, and it's really nothing to rush. You don't want to rush this. And I like to get up by the nostrils. Most of us have hair up there too, and I stretch it as much as I can. And then wait a few seconds. The middle of our lip is the most sensitive, so I give it an extra long waiting. There we go. And then you can see, place the glass right on the edge of the lips. Wait a few seconds. No reason to be in a hurry. And it also protects, go ahead. It also protects the patient's skin when you wait and let it really cool a few extra. And since Jessica has Greek and Italian heritage, I like to be a little extra careful. The darker the skin type, the more chance you have of hyper and hypopigmentation, blistering, and all the things you don't want. So, okay, that's it. You did great, Jessica.
Thank you.
Thank you.